In the mid-1990s, the CDC and Kaiser Permanente conducted an investigation that studied a newfound epidemic that was lowering the life expectancy by nearly 20 years. This epidemic heavily affects brain development, the immune system, and hormonal systems. It triples the risk for heart disease and lung cancer. However, most doctors are often overlooking it. This epidemic is child trauma. Good morning, my name is Taryn Barger, and today we're going to be looking at the lasting effects child trauma has on adults. What kind of trauma are we talking about? We're talking about any kind of abuse, physical, sexual, mental, and verbal, and we are going to be looking at neglection, both mental and physical. This prompts us to ask the question of to what extent has experiencing child trauma negatively affected a person's development into adulthood? A study known as the Adverse Childhood Experiences Study, or ACEs, observes over 17,000 adults who were asked about adversity they faced during childhood. The outcome was not how researchers expected. 67% of these interviewed had experienced at least one ACE, and they found a direct correlation with having a high ACE score and having poor mental and physical health. We're going to look at how the brain development is affected, the establishment of mental illness, and how trauma leads to substance abuse. The brain is the control center of the entire body. When neurological development is altered, it poses a large risk for a person. There are three specific parts of the brain that childhood trauma affects: the amygdala, which involves experiencing emotions, the hippocampus, which is responsible for storing memory, and the prefrontal cortex, which regulates emotions and impulses. Each of these regions mentioned play a viable role with having experienced trauma. Cortisol and norepinephrine, which are utilized in your fight or flight response, take place in these affected regions. This can cause problems in reaction time and response production. Here we can compare two images of the brain. This is a fully developed, healthy brain, and this is a brain that has been stress invoked throughout a person's life. In the right brain, the amygdala is overstrengthened, which develops emotional dysregulation or the inability to control your emotions, and has a severely weakened prefrontal cortex, which eliminates impulse control. Coincidingly, emotional dysregulation is a common trait of post-traumatic stress and other mental disorders like anxiety, depression, and bipolar disorder. Here, in this graph, we can see from the Annals of General Psychiatry, adults who observed psychiatric outpatients have severely high prevalence rates in mood disorders such as schizophrenia, adjustment disorder, anxiety disorder, and mood disorders. Mood disorders can be shown having severely higher rates than any of these other ones. Some of these mood disorders are bipolar disorder, major depressive disorder, and hypomania. As previously stated, neurological development is severely affected by childhood trauma. As you can see, there are two types of responses that can be produced: behavioral and physical. In the behavioral response, it develops mental illnesses like depression and anxiety. Oftentimes, victims of childhood trauma use drugs and alcohol as a coping mechanism. This typically comes out as a way to handle mental health problems that can occur from experiencing such trauma. Countless studies have shown convincing data proving the more ACEs a child has, the more likely they are to struggle with substance abuse. Here we can see that the people who have developed drug addiction have a 1,003% higher chance of developing drug addiction when they have four ACEs, and a 740% chance of developing alcoholism. This graph makes drastic increases as the ACE scores go up. They all start at 100% and then go up as they have more. Similarly, in this infographic, people with 4 or more ACEs are far more likely to develop drug problems or already have one. People with 5 or more have significantly higher drug problems. This is for ever having a drug problem, ever being addicted to drugs, or ever injecting drugs. Resilience is the process of adapting to stressful circumstances and situations. Victims must use this resilience in order to overcome the challenges faced so young in their life and in order to move forward many years later. This has prompted us to the solutions and limitations, which are to provide more support groups throughout school campuses as a child develops. A limitation to this is so many young people are afraid to come over due to fear that their abuser or neglector could harm them again. Another solution is for health professionals to realize these health problems come from being built up. Another is that medical professionals should be asking patients about child abuse when exhibiting such high-risk behaviors. A limitation to both of these is many medical professionals feel that so many years have passed that they are no longer relevant to the patient. These solutions and limitations have led us to the conclusion that although it is statistically impossible to completely eliminate child abuse and neglection, medical professionals must become more aware and acknowledge the detrimental effects that childhood trauma inflicts. Here are my sources. Thank you. Any questions?
2 questions for you. What information did you need that you weren't able to find?
I was struggling to find information about specific mental illnesses like drug addiction. It mostly just showed substance abuse as a whole, drugs and alcohol.
Okay, and if you had more time, what additional research would you do?
I wanted to use how childhood trauma puts an impact on interpersonal relationships, such as romantically and friendships.